Assalamu alaikum. Now I would like to discuss about the antipsychotic extrapyramidal effects. This is very high L topic, very high L topic. Okay, in antipsychotic, usually typical antipsychotic cause these type of effects, extrapyramidal effects. How you can remember by remembering adapt, acute dystonia, akathisia, Parkinsonism, and tardive dyskinesia. Acute dystonia, akathisia, Parkinsonism, and tardive dyskinesia. What is acute dystonia? In acute dystonia, there is sudden, sustained contraction of the neck. Sudden, sustained contraction of the neck, mouth, tongue, and eye muscle. Sudden, sustained contraction of the neck, mouth, tongue, and eye muscle. What you should give in this case, BD is the drug of choice, benztropine and diphenhydramine. Benztropine and diphenhydramine. Akathisia is subjective restlessness, inability to sit still. Akathisia is subjective restlessness and inability to sit still. In here, you should do triple B, beta blocker, benztropine, and benzodiazepine. Beta blocker, benzodiazepine, and in Parkinsonism, Parkinson-like feature like gradual onset of tremor, rigidity, bradykinesia. In here, you should get AB, that means amantadine, and benztropine. And in tardive dyskinesia, there is gradual onset after prolonged therapy, gradual onset after prolonged therapy of antipsychotics. There is dyskinesia of the mouth, face, trunk, and extremity. More than 6 months, she has to take in the drug for a long time. And the drug of choice for treating these tardive dyskinesia is valbenazine and deutetrabenazine. Valbenazine and deutetrabenazine. Hey, regarding acute dystonia, I would like to talk about other feature. Extrapyramidal syndrome also include like acute dystonia, which is sustained, look like torticollis, which is characterized by sudden, sustained muscle contraction, resulting in twisting of abnormal posture, like torticollis, classical Parkinson, rather than the classic Parkinsonian resting tremor found in this patient. So you have to differentiate. You have to differentiate between drug-induced Parkinsonism and the acute dystonia. In acute dystonia, torticollis-like feature should be seen. But in classic Parkinsonism, there may be resting tremor may be found. Resting tremor may be found. Acute dystonia and extrapyramidal symptom can occur with dopamine antagonists like metoclopramide, prochlorperazine, as well as most antipsychotics. Other extrapyramidal like Parkinsonism, akathisia, both of which can occur after the use of dopamine antagonists such as metoclopramide. So metoclopramide is the drug used in nausea vomiting in pregnancy. So in this case, acute dystonia may happen. But after giving metoclopramide extrapyramidal syndrome, acute dystonia may happen. Acute dystonia may happen. For acute dystonia, drug of choice is benztropine and diphenhydramine. Benztropine and diphenhydramine. Benztropine and diphenhydramine. Okay, in tardive, in This is tardive dyskinesia. This tardive dyskinesia happens after 6 months of prolonged use of antipsychotics. In here, there is abnormal involuntary movements due to prolonged use, more than 6 months use of antipsychotics or metoclopramide, more than 6 months use of antipsychotic. High yield, this is very high yield. Metoclopramide is a drug uh, used in nausea, vomiting, can be used in mm dumping syndrome, can be used in dumping syndrome. So if it is used this drug is prolonged use of this drug can cause tardive dyskinesia. There may be orofacial dyskinesia, there may be limb dyskinesia, there may be trunk dyskinesia, greater risk with first generation antipsychotic. Orofacial dyskinesia like trunk protrusion, lip smacking, and grimacing. Trunk protrusion, lip smacking, and grimacing. Like limb dyskinesia, like dystonic posture, foot tapping, and chorea. On trunk dyskinesia like rocketing, thrusting, and shoulder shrugging, rocketing, thrusting, and shoulder shrugging. Discontinue of the causative medication if feasible. Switch to second generation antipsychotic like quetiapine and clozapine. If continued antipsychotic is required, treat with valbenazine and deutetrabenazine. Second generation antipsychotic can cause this type of tardive dyskinesia. Like this patient with facial grimacing combined with foot tapping and inversion movement, which are likely to foot tapping and inversion movement, which are likely to tardive dyskinesia caused by exposure of the risperidone. Risperidone, a second generation antipsychotic used in the treatment of bipolar and the psychotic disorder. Like schizophrenia, you can use antipsychotics. Like in any acute manic episode, antipsychotics can be given. So in these cases, uh, you can give these drugs. This is tardive dyskinesia, orofacial dyskinesia, limb dyskinesia, and trunk dyskinesia. More than 6 months, valbenazine, deutetrabenazine. Tardive dyskinesia is an involuntary hyperkinetic movement disorder resulting from prolonged use of dopamine receptor blocking drug. The use of dopamine receptor blocking drug like antipsychotic like metoclopramide. Management option is reducing the antipsychotic dose using valbenazine, deutetrabenazine, which is the inhibitors of the VMAT, vesicle monoamine transporter 2, recently approved by FDA for the use of disease. Switching, cross tapping, switching or cross tapping, switching to an antipsychotic of lower tendency to cause a tardive dyskinesia like quetiapine, like clozapine in patient with history of poor response to multiple antipsychotic. In the patient with a poor response to antipsychotic, in the patient with a poor response to multiple antipsychotic, clozapine is the preferred option. Poor response to multiple antipsychotic, clozapine is the primary main thing. Okay, that is all about the adapts. Hope you enjoyed.